From the recent floods in Kentucky to the devastating impact of Hurricane Ian in Florida, we have certainly had our fair share of natural disasters as of late. But how do these impact overall public health? Here to discuss this morning is Professor and Chair-elect of the Environment Section for APHA, Natasha DeJarnett. Thanks for your time this morning.
Thank you so much for having me.
Let's start with the big question. For people who may not put two and two together, how do natural disasters, climate change, impact overall public health?
Absolutely. There are a number of climate impacts to health, and that includes poor air quality, that includes extreme heat, extreme weather. We also have extremes in precipitation, flooding on one hand, drought on the other, and changes in vector-borne diseases. So this can increase our risk of cardiovascular diseases. This can also increase our risk of respiratory diseases, heat-related illness, diseases that might be related to malnutrition or poor nutrition. In addition, it doesn't only affect our physical health, climate can also impact our mental health and well-being.
You know, I think that obviously climate change, the impact of climate change is very far-reaching, but it does seem to impact maybe disproportionately those that have already been subjected to structural racism. Do you agree with that? And if so, what can we do about that?
I absolutely do agree about it, and I am appreciative that you brought this topic to the forefront because climate change is a threat multiplier for the populations that are most burdened, and these often can be those that are often bearing the burden of structural racism, and this is for a number of reasons. There are historically structurally racist policies that continue to shape our community even after they've ended for 50 years. So, for example, redlining. Communities that were formerly redlined still today face disproportionate health burdens, and they face disproportionate climate burdens that impacts their health. So, for example, formerly redlined communities are hotter. Their surface temperatures are hotter, so they're more likely to be those urban heat islands. They also are more likely to be in flood zones. In addition, they are more likely to have poor air quality. And so these can be linked with conditions like cardiovascular disease and asthma in our children, also for our older adults, and populations that would bear a greater burden in those ways. So there are a number of historic policies that can contribute to why climate change's burden is not evenly distributed across our communities. So what can we do about it? There's much that can be done, especially in the place of public health. So there is the Health in All Policies framework. This ensures that health and equity are at the center of policy. So when it comes to climate policies, utilizing a Health in All Policies framework to identify mitigation and adaptation preparedness, this can really help strengthen our communities, ensure that equity is at the center of climate action. In addition to that, for those of us that work in research like myself, you can engage in community-based participatory research. This is where the community is involved from the beginning, from not just the beginning of, here's our project, this is what we're going to do. No, from identifying what the problem is and what the solution should be, all the way through evaluating and implementing the project.
All right, before I let you go today, so, you know, I mentioned the floods in Kentucky, also obviously Hurricane Ian in Florida. We have had, like I said, our fair share of natural disasters, it seems. Do you think that with the frequency that we're starting to see these natural disasters, that's a precursor of things to come here in the United States?
Absolutely. With climate change, we're seeing more frequent and more intense extreme weather, and we're also seeing more frequent and more intense extreme precipitation, whether that's flooding and whether that's drought. So yes, this is a sign of things to come. This is a unfortunate wake-up call for us that this is happening now, that this is real, that it's affecting health today, but also reminding us there's much that we can do about it. We can do things that can prepare our communities for the threat of these extreme weather, extreme rainfall events, but also that we can mitigate to prevent this.
Wonderful. All right, thank you so much for your time today. Certainly appreciate it.
Thank you for having me.